Hello everybody, I am Dr. Pulkit Nandwani. I am a consultant, gynecologist and laparoscopic surgeon at Saroj Medical Institute, Rohini. So, if you are about to undergo any operation, especially total laparoscopic hysterectomy, for whatever the indication might be, this video would be very useful for you. Once an operation has been decided, the patient gets really scared because of the unknown factor. What will happen once you are admitted in the hospital? What will happen after the operation? How will you go through it? Just knowing the basic details of the hospital stay and treatment will put you a lot at ease. So, on the day when you are supposed to undergo total laparoscopic hysterectomy, you would be asked to come to the hospital for admission, usually early morning, and that also empty stomach. We might even ask you to have just a light diet the previous day or even liquid diet the previous day, and then not take anything after that from 12 o'clock in the night, and come absolutely empty stomach to the hospital in the morning with all your records, all the blood tests, the ultrasound reports that would have been done previously when the operation would have been decided. Once you are admitted in the hospital, a sister will be in charge of you. You will be given a bed. You will be asked to change your dress. The area where we have to operate would be prepared by doing shaving of hair of that area, and then an IV cannula will be inserted. Following this, all the medications, all the glucose, all the IV fluids would be given through this cannula itself, and you would not have any other pain except the cannula pain. After that, an anesthetist will come and have a word with you, and have a pre-anesthesia checkup will be done. Then at the scheduled time, you will be shifted in the operation theatre. Once you are in the operation theatre, again through that IV cannula line itself, medicines in the form of injections would be given, a mask would be put on your nose, and you would be put to sleep. The whole operation, which would be undertaken by a team of doctors along with a multitude of workers along with us, technicians, nurses and anesthetists, the whole procedure will take around 1.5 hours to 2 hours, and then post operation, once we find that you are stable, you would be shifted to the post operative room, where you would be kept there for another 3 to 4 hours just for extra monitoring, following which you would be shifted to the room. After the operation, once you wake up, you will just have little grogginess, heaviness of the head which would be for the after effects of the anesthesia. You would not be allowed to eat at that time. All the nutrients for the body will be given by the IV fluids in the form of glucose. All the medicines in the form of injections would be given. There would be a catheter inside the urinary bladder to allow drainage of urine. This catheter we will remove most probably the next day morning itself. So, we will start food for you either in the evening or the next day morning. Liquids will also be started first, and then slowly food will be started. You might be asked to ambulate, get off the bed on that very evening itself. This is the advantage of a total laparoscopic hysterectomy. The next day, you will be kept inside the hospital, but you would be eating properly, you would be ambulating, walking around the hospital just for observation and dose amount of injectable antibiotics. You would be kept inside the hospital. The day next to that, you will be discharged at home. We put dissolvable sutures, over that we put waterproof dressing. So, the very next day of the operation and throughout after that, you are allowed to take bath. Just vaginal hygiene has to be maintained. At home, heavy weight lifting or bending a lot would be just advisable not to do, but other than that, routine procedures at home, routine activity at home is allowed. For a checkup, you will have to come after a week. I hope the video was informative for you and would put you at ease. I am Dr. Pulkit Nandwani, a gynecologist and laparoscopic surgeon here at Saroj Medical Institute. And if you want to contact me, you can contact me via live rate or take an appointment at the hospital at Saroj Medical Institute. Thank you.